Welcome back to Plastic Surgery Untold, greatest podcast in the world, as voted by us. We got our dream team here. One Gilbert P.A., Austin's most beautiful man, looking absolutely fabulous today, sir.
Thank you, sir. Appreciate it.
Dr. Chang, who leads our wellness team, and then of course TikTok famous nurse Sarah needs no introduction. And so, but let's jump right into it because we got a super exciting topic and something that we've basically developed and evolved out of a necessity at our practice, osteoplastic surgery, in terms of the tummy tight procedure, because we've had so many patients living their fit and fabulous life, working hard in the weight loss revolution, and some of that they've just seen a little bit of skin laxity in their tummy. For a lot of our patients, they're in that 15 to 20 pound weight loss stuff, just a little something where it's absolutely fabulous for their overall health and well-being, and they feel fabulous. They lose some of the inside visceral internal fat that we talk about, but then resultantly just get a little bit of loose skin right at the belly button. And Dr. Chang, I know this is something that you talk to all your patients about when you start them on the journey, that there's so many medical benefits, but some of the secondary effects can be with weight loss is a little bit of skin laxity.
Yeah, exactly. I mean, we try to make sure that we sort of set just all the different potential outcomes of going through the weight loss process. And so obviously I do focus a lot on the medical benefits that you said, but it's very natural for people as they're going along. They're losing a little, a few pounds here and there. What's very hard to control is that we don't always know exactly where those pounds are coming from. So depending on kind of how you're built and how your metabolism works, I mean, you may be losing pounds from either arms or belly or, elsewhere. And so, so we try to have that conversation just to kind of prep people to say, yeah, you might notice a little bit of loose skin here and there. And by the way, we're here to help you with that if that happens.
One of the things I think Nurse Sarah and I both noticed as we did this, because there's an area that's always super hard to treat from a surgical standpoint, and really currently there's no way to treat this, is the visceral or internal fat of our tummy. And in the old days for men, it was referred to as a beer belly, but honestly in Austin, it can be anything. It can be a barbecue belly. It can be, a breakfast taco belly, but really can come from anything that really only diet and exercise can really help remove. And so when you think about it, when you deflate that belly, some of that skin can be laxed. And we've talked about Ozempic, face, butt, those things, but really want to focus on the tummy itself. And so, we've developed a whole process in terms of combining energy, biostimulants, and really some structural support to the tummy to really coach that skin into a phenomenal spot. So I want to turn it over to Nurse Sarah and PA Gilbert to maybe just talk about some of those options, and then we'll tell you about how we've combined this into a tummy tight procedure that really non-surgically has made a massive difference for some of our patients.
Yeah, absolutely. I can start if you want, Gilbert. So the abdomen, I think, has become super popular for my patients. One, because I think for a while patients didn't realize that we could do anything non-surgically for this area.
In the past, there weren't great options.
There wasn't. Yeah, exactly. So we talk a lot about that when we see you in your consult. But thankfully, technology keeps getting better and better. And we now do have several non-surgical procedures that we can provide for that skin tightening component, and as well as just improving that skin texture, maybe a little bit of stretch marks, a little bit of the crepey skin texture in the abdomen, in other areas of the body, of course. Typically, this is going to be looking like a series of at least 3, sometimes more. If you're still on your wellness journey, then, I get asked all the time, should I start now? Should I start after? We do recommend starting, while you're still on the journey, because you will be at a much better spot than if you didn't. And we both say that ourselves, wishing that we would have started a little bit sooner. That doesn't mean that you may not want to treat again once you hit your weight loss goal, right? If we want to keep you as tight and fit and fabulous as we possibly can. But just a typical, if we have a couple options. So radio frequency microneedling, we can offer at all of our locations. We've got Morpheus, we've got Vivace. These treatments will always be at least a series of 3. spaced about 4 to 6 weeks apart. But I've seen incredible benefits in the abdomen from here when we're talking about, especially above the belly button, just a little bit of that.
Literally turn that frown upside down.
Yeah, literally. And Dr. Franco's the one that told us about this incredible addition that I know he'll touch on here in just a second to help in the healing journey. And then we also have the option now of SoftWave, which uses ultrasound energy. The great thing about all of these procedures is very minimal downtime, or no downtime if we're talking about SoftWave. So of course, if you have a significant amount of loose skin, we can get you over to the surgeons. But if you're looking for something with, very minimal to no downtime, improvement, but not necessarily needing a tummy tuck, then we're excited to provide options.
And Gilbert, talk to us a little bit because, it's basically a 3-step process. So we have the energy, we have the biostimulant, and then we'll talk about the skin support that we'll do, the superior support, if you will. But tell us about biostimulants. I know that's a super passion of yours. You've spent some time with Chino Bay out in Florida, really kind of honing in that skill. But that spot right above the belly button that we're talking about from the skin tightening also can be a little bit of volume loss. Some of that comes from the diastasis. How have you incorporated some of the biostimulants? Because I know it's more than just adding volume. You're actually trying to structurally stimulate some collagen support there.
Yeah. So as we've talked about in the past, we lose collagen as early as our mid to late 20s, and we lose about 1% of the collagen in our entire body for every year. So if you think about it, when let's say you started losing at 25 and now you're 40, you've already lost 15% of your collagen in the entire body, right? And so what we're trying to achieve with these treatments is stimulating that collagen, one by utilizing biostimulants like Sculptra, like hyperdilute radius, and then combining that with the energy-based devices that Sarah was just talking about to help create some of that tightening effect, help stimulate some of that elastin, which helps kind of alleviate some of that skin laxity, some of that elasticity issue that we may be seeing with these weight loss problems or weight loss journey outcomes, I should say. Really trying to focus on getting that collagen to just tighten the skin up.
And I think sometimes people confuse this because they're like, well, I'm trying to lose all this weight in my tummy. Why am I putting a filler into my tummy stuff? But the volumes that you're using are not used to increase any volume in the tummy, correct? Can you maybe elaborate on that a little bit? Because I think it's sometimes confusing. I'm working to get rid of my tummy. Why am I injecting filler into my tummy?
Yeah, so if you think about it, I think a lot of us really kind of have this idea of fillers as volumizing, right? Because for the longest time, we've been using these hyaluronic acid fillers.
And we call them fillers.
And we call them fillers, right? But in this case...
Which is probably not a great term for actually what we use them for in this day and age.
No, because there are so many different applications for them, right? And so I think if we can kind of get our mind around the idea that, not all fillers are meant to volumize. And in this case, we're using them as a way to stimulate the collagen and the elastin in the skin, not so much to create volume. I think that can kind of get patients' idea away from, I'm going to be making my tummy fuller or bigger. And so I think just proper education using, a different approach with the language that we use, I think will make a big difference.
But something we should touch base on a different episode is maybe why we shouldn't use the term fillers anymore, because I think back in the day, we just tried to overfill people's faces so much. And a lot of that happened because there weren't, some of the good skin tightening devices and other things out there. And that's where, I think a lot of the negativity from fillers came from. But now, in my mind, and from the things that you guys talk about all the time, it's really more of a structural support. It's more of this precision placement. It's more of this artistic, contouring of the face. And I don't even like the word filler, because if anything, it's voluming, in a strategic, targeted, and more of a support and structural building block than anything else. If you guys agree.
Yeah, absolutely. And you came up with the term structural sandwich or structural synergy. So y'all see us do this a lot in the face when we're doing radiofrequency microneedling, combining that with Sculptra or hyperdilute radius. We can do, just like Gilbert said, the same thing in the body. And that's where I think you really get the best benefit, because we're stimulating that collagen at multiple levels, right? Through the skin with that radiofrequency microneedling, or penetrating with the ultrasound on the soft wave, and then being able to inject a little bit deeper with the biostimulant, like Gilbert said. So you're really going to take your results to the next level by doing that combination, and we can do it on the same day.
And really the trifecta for the tummy type procedure, right, is the energy, whether this is RF microneedling, whether it's soft wave, whether it's the biostimulants, and maybe we'll get into those two options in a little bit more with PA Gilbert. But, I think that's huge. And then we've also developed this structural support. You've seen us talk about it, in the face and other areas, and you've seen us talk about in the breast, because we're trying to hold those implants in a spot. This is where we stimulated the idea, and actually saw a friend of mine in Latin America who was talking to me about about this, but we actually do some coaching of the skin. And so we'll support it in a superior position. So if we coach that skin up, we let that energy take effect. We add in the biostimulants. Now we've positioned the stip. We've coached it to where we want to be. We're holding that spot. So that's why we call it this superior structural support for the skin, to be able to get it to lock down into the perfect spot. So if you think about it, you're holding it where you want to be. You're trying to defy gravity. So we're taking that weight off the skin, because if you take that weight off, now it's going to be able to scar into and sit right where we want it to be, and then opens it up. Because with the belly button, you don't have to make a huge change just to make a really nice change. Because the idea is we're trying to get everybody, summer bod ready. Little bikini bodies coming soon. And so, I've got my bikini coming ready soon. So I got to open up my tummy just a little bit. But I really think it's the combination of all these treatments. Gilbert made such a great point in terms of the collagen you lose. There's actually some studies going on now to see how significant weight loss even affects that. And unfortunately, I think it's going to affect that collagen even a little bit more as the body needs a little bit of time to reset for some of this. And no question with the volume loss that Sarah put out, I think you can't start soon enough, because it does take a while to see these effects. Most of us, once we start to lose weight, we want to look as fabulous as we feel right now. And most of these energy and biostimulant devices take at least 6 to 8 weeks to see some of the effect. And that effect will actually get better for months.
Yeah.
Yeah, absolutely. And then just to kind of lay it out for you. So we've kind of touched on it, but the actual tummy tight aspect is we're going to give you some KT tape, right? And literally explain how to use it. So it's super simple, just a way to take your results to the next level. If we did RF microneedling, we'll probably have you wait a few days because the skin will be a little bit irritated. If we did the soft wave, remember that one has no downtime. So you can literally put it on right away. I can put it on for you. And I love the term that you use, coaching the skin. That's so perfect, because we're creating this controlled injury, right? And we want it to heal in place right where we want it to land, essentially. So you're putting a little bit of support on the tummy, pulling up on that belly button. Like you said, not a lot. We don't want it to look abnormal, right? But just enough to provide that support to really take your results to the next level. And I think typically we have you leave it on for about 3 weeks. Is that right?
Yeah.
Change it every couple days. Super easy addition just to, help maintain those results and take them to the next level.
Yeah. I mean, you guys know that we love stuff that's simple and things that are easy to follow. So it's the tummy tight procedure, which is the trifecta, which is the trifecta for 3 weeks. So you're basically getting some energy. You're getting some biostimulant. You're getting some skin coaching. So you're getting 3 different things that we're doing to get you to a great spot with that. You're doing it for 3 weeks, to get that tummy just tight and right. Yeah, 100%.
And 3 times.
Yep. And you're doing at least 3 treatments of the energy to it. Remember, this is going to vary a little bit. 3 is just the minimum in terms of treatments. Like Gilbert stated, number 1, even when you get to a great spot, most people will do this at least once a year, because unfortunately our skin isn't going to naturally get tighter or toner just on its own.
Yeah, I mean, it's a natural aging process, right? So even though we stimulate this collagen with these different modalities, we're still aging, right? So we still want to be able to maintain what we've been able to gain. So yes, we kind of have to play catch up a little bit initially, but then it's more of like a maintenance plan, a maintenance game. So.
And I think the other point, and either Gilbert or Sarah brought this up earlier, remember, depending where you are on this weight loss journey is going to depend how many treatments you need. So 100%, you guys have heard me talk about if I could change anything, I would have gone back and started this sooner in terms of addressing my skin issue stuff. But if you're like me and you're on this weight loss journey to get to your goal for over a year, you're likely going to need more than 3 treatments, because as long as you're still losing weight, you're still fighting that skin sagging feature stuff. And this is where I do think, the energy, the tummy tight procedure goes along with some of the stuff Dr. Chang talked about in previous episodes about making sure that your overall labs, health, and fitness is in a great spot. And so the whole concept of this completion consultation comes to full circle, because all that stuff goes together in terms of maximizing your overall results. I love this. I'm super excited. In summary, the tummy tight procedure is a couple things. It's an energy device. It's a biostimulant. It's coaching the skin into a great spot. It's the trifecta for the tummy tight. You're going to need a series of at least 3 of those over a period of time, but super dependent. We'll coach you through all this just as we're coaching the skin. Any last words of wisdom from our dynamic team here, the other trio of the team?
I love this. Actually just I think these are great talking points here. I love to be able to present this to our patients and just to help them through the process. I think Sarah made a great point earlier about the question about, and as you've already stated, do I do this now or do I wait, right? And I think that's the more that we can reinforce that, the better results we're going to have and just the better overall journey.
Gilbert, before we go on, and I forgot to ask, and if you don't mind backtracking just a little bit, when we talk about biostimulants, you talked a little bit about Sculptra and hyperdilute radius. How do you decide which one's, and I'm using quotation marks if you're listening, better for patients? They both got pros and cons. I like them both. And then maybe Sarah can jump in too. How do you decide which one you're going to use for a patient? It's challenging.
Yeah,
and there's some new stuff coming, so don't go anywhere.
That's actually a really great question. I think a lot of it boils down to just having a good consultation with the patient in terms of, what their expectations are. Like you said, each one of these two products have their pros and their cons. And then it's up to us as providers to take the information from the patient and translate that into our decision making as far as what's going to be the best product for them in that particular situation with what they're hoping to achieve.
Is there one that you've leaned more to in terms of the abdomen body stuff versus the face, or not necessarily?
Not necessarily, but as you mentioned, I did do some training with Dr. Shino Bay Aguilera in Florida, and he's a big sculpture guy. He does a lot of radius stuff too, but I think he's more known for his Sculptra injection techniques and regenerative outcomes that he gets from those. And so, I've kind of just, taken that with me and just kind of focused more on using a little bit more Sculptra over hyperdilute radius. But without question, there's a place for both of them.
And this is where I'm super excited about Acorn, which you guys have heard us talking about. We're probably about a year away from having some exosomes, personalized exosomes from yourself that are in an injectable form. And that in combination with the RF energy is mind-blowing to me and super exciting. So I can't wait. It can't get here soon enough. So Acorn, if you're listening, keep moving, because my tummy needs to be tight. My hair on my head isn't getting any thicker. So I can only wait so long. Nurse Sarah?
I would say, and I agree with Gilbert. I think both products are great. It's hard to really choose. In my practice, what I am more likely to do is Sculptra in the face, and I use hyperdilute radius in the body.
That's weird because it was easy for you to pick a favorite child, but hard to pick a favorite product.
That is
in case
not
they're
true.
listening, we won't tell you which one
that
you picked.
That is not true. I love all of you exactly the same. And I think that's just because that's what I do. I've gotten great results that way, so that's what I'm sticking with right now. But we're constantly researching and doing education, and I think our techniques are constantly changing. So right now, I lean towards hyperdilute radius in the body, Sculptra in the face. I think it's been working really well, and the results have looked great and undetectable, which is one of my favorite things about it.
There's some really cool things coming. We talk about Acorn. There's another company coming to market actually in the next couple months that we'll be bringing to you as well. That's going to have some absolutely phenomenal opportunities. I haven't even shared it with my co-hosts here, but some really, really cool stuff in the near future. So excited to share all of that with you guys. Tummy tie procedure developed by us for you as part of your weight loss revolution. Also, I can't go this episode without talking about you all have been co-authors in about 3 articles in the last 2 months on the whole weight loss revolution. Structural synergy was actually published in January, February of Metastatic. So check that out. Maybe we'll do a little link to that. It was absolutely fabulous. Yeah. And then I've seen 2 more articles on the weight loss revolution just this month. So congratulations to you guys. Thanks for helping write these articles. And so Plastic Surgery Untold, greatest podcast in the world, is voted by us. Check us out anywhere you get your favorite podcast, iTunes, Spotify, iHeart. If you want to see Austin's Most Beautiful Man, please feel free to check us out on YouTube. We'll see you guys soon. Bye.
Bye.